Your heart is about the size of your fist. It beats without rest, without pause, every second of your life. Around 100,000 times a day, over 35 million times a year. More than 2.5 billion times in a lifetime. It pumps enough blood every single day to fill a small fuel truck, and it does all of this silently. But there is one moment when just for hours can decide whether your heart survives or begins to die. A heart attack, also called a myocardial infarction, happens when one of the coronary arteries becomes blocked. These arteries are the only blood supply to the heart muscle itself. When blood flow stops, oxygen stops. And without oxygen, heart cells begin to die within 20 to 30 minutes. This is not dramatichismo. Every minute matters. If a patient reaches the hospital within about 4 hours, doctors can often reopen the blocked artery. They perform a procedure called angioplasty. A small balloon is guided into the artery and inflated to push the blockage aside. Then a tiny metal mesh tube called a stent is placed inside the artery. The stent keeps the vessel open, restoring blood flow. When done in time, the heart muscle can survive almost completely intact. But if treatment is delayed, the damage becomes permanent. The part of the heart muscle that does not receive oxygen begins to die. Dead heart tissue does not regenerate. It turns into scar tissue. Scar tissue cannot contract, it cannot pump. That means the remaining healthy heart muscle must work harder for the rest of a person's life. This is why recognizing the symptoms is critical. Chest pressure or tightness, pain spreading to the left arm, shoulder, jaw, or back, shortness of breath, cold sweats, nausea. Some people describe it as an elephant sitting on their chest. Women may experience more subtle symptoms like fatigue, dizziness, or discomfort in the upper body. Never ignore these signs. Here is something most people do not realize. The heart has its own electrical system. It can generate impulses without input from the brain. In certain medical situations, a heart can continue beating for a short time, even outside the body, if it receives oxygen. Your heart also begins beating just 5 weeks after conception. It is one of the first organs to function and the last to stop. There is even a condition known as stress-induced cardiomyopathy, sometimes called broken heart syndrome. Severe emotional stress can temporarily weaken the heart muscle. Grief, shock, extreme fear. The connection between emotion and the heart is not just poetic. It is physiological. The difference between a full recovery and lifelong heart damage can be a matter of hours. For hours can mean the artery is opened, the muscle is saved, and life continues normally. Or it can mean permanent loss of heart function, knowing the signs. Acting immediately. Calling emergency services without hesitation. That decision can save a life. It could even save your own. If this video made you think, even for a moment, don't scroll away. Share it with someone you care about, because one day, for hours might be the difference between life and permanent damage, and in that moment, this information could save a heart. Maybe theirs, maybe yours. Subscribe for more videos that give you knowledge when it matters most. Listen closely. That sound you hear is your heart. Don't take it for granted.